Hello everyone, good morning. I'm just taking a walk this morning. I actually dropped my car off for service and I want a little bit of exercise. And what I really wanted to talk to everyone about today was a problem that's prevalent and I see all the time, which is having lower eyelid surgery after having had filler placed in the lower lids previously. Whether once, twice, 5 times, 10 times, it doesn't make a difference. Why do I bring this topic up? Because I love filler, don't get me wrong. I think it's a wonderful tool to efface eyelid hollows and eyelid bags. In other words, smooth the transition of the eyelid and the cheek. When done appropriately in the appropriate patient with the right product, with an experienced injector, people do well. Like everything though, fillers, in my opinion, are often indiscriminately injected into lines and folds on patients without really identifying their candidacy and what the patient's long-term goals are. So while fillers work well early on, what happens over time and what happens when it's time to have eyelid surgery? Do they have a negative consequence? And that is the topic that I want to talk about today. And I have a lot of experience with this because on a weekly basis, I see this over and over. So again, to start, fillers are great when done appropriately in the right patient by a good injector. So what's the problem? We've talked about this before. Fillers work by imbibing fluid. They're hydrophilic. And when they do that, they fill hollows. And when the hollows under the eyes are filled, where the transition of the eyelid to the cheek occurs, the eyelid bag looks less. Why? Because the valley is elevated to the level of the hill, if that makes sense. Now, someone will have filler placed, and let's just say, for discussion's sake, they have a cup full of filler placed in the lower eyelid hollow to make the hollow go away and make the bag less prominent. So a year goes by and they come back for more filler because the clinical response is gone. In other words, the hollow's back and the bag you can see again. But just because the clinical response is gone doesn't mean the filler is gone. These don't correlate. If an ultrasound or MRI was done on every patient that wanted more filler because they don't see the effect of it anymore, we would find that there's still filler there. Now, the filler that's there is very different than the filler that was injected. Why is that? Because our body has a natural dissolving agent called hyaluronidase. That's what we use to remove or dissolve filler when it's appropriate and needed to be done. So that's going to wear away the filler, but it doesn't wear it away equally. It wears it away different parts to the filler. Sometimes you get it worn away more on the inner part of the eyelid where the filler was put and not the outer part, or sometimes the center of the filler material gets affected more than the outside of it, or vice versa. So the product changes. These products have a concentration, certain number of parts per area, and that allows them to imbibe fluid in. They're also cross-linked, kind of like a picket fence is cross-linked, and that gives them stability. So these two concepts of cross-linking and concentration are the biochemical characteristics which give filler their clinical response. The more cross-linked, the more stable and long-lasting they are. The more concentrated, the more fluid they pull in, and the more their clinical effect of expansion and filling. Well, someone comes back to have filler placed after a year, and the concentration and cross-linking have changed because facial movement, we move our face around, it breaks down the filler, and also our natural hyaluronidase can break down the filler, so now it's a different product. So we put more filler in because the patient wants more clinical response. The new filler we put in is identical to what was put in originally, but now it's being admixed with a different product and different biochemical characteristics. So now we have a whole different product that behaves differently. And what I find is on the second, third, and fourth injection, that there is much more swelling and color change than there was previously. And this is pretty typical, and this is why I think that we have to be very careful about refilling. So that's an important concept, is because the clinical response is gone doesn't mean the filler is gone. And be very careful when you refill and how much you put in, because sometimes we got to be careful what we're asking for, because the issues that occur with this can have long-lasting implications on what you do in the future when you get to the age where filler no longer works and you need eyelid surgery. So let's talk about that for a second. About 40% of the people that come into my office now for eyelid surgery, and because that's my specialty, I do a lot of this, have had filler placed. And the problem is they may not even have a clinical response to filler, but on examination, I can tell it's there. Well, you have to dissolve it because you don't know what you're dealing with, and how could you make a good surgical plan when you don't know what the eyelid really looks like? So you start dissolving. What happens when you dissolve? You wear away the filler. Now the eyelids look different. There's no way in the world you can be absolutely confident and sure that someone's a good filler candidate if you're going to dissolve them before. If someone's a good eyelid surgery candidate if you dissolve them beforehand, because you don't know what the eyelids are going to look like. The degree of prominence or fat in the lid and the degree of hollows. You may dissolve someone and find that you can't do surgery, that they're not a good surgical candidate. You may dissolve someone and find out they're a great surgical candidate. So the problem with long-term filler is it masks what the eyelid looks like, it masks the natural aging process, and it makes it more complicated to decide your candidacy for surgery until it's removed. And sometimes when it's removed, you identify you're not a good candidate. Well, then what do you do? Then you're still hollow, and you have to go back to fillers, grafting fat, something else. So these are things to keep in mind with the long-term use of fillers. The most common things we see with fillers are edema, swelling, because they imbibe fluid, and a color change, what I call dyschromia, usually a blue color change. These things also mask the natural appearance of the eyelid, so they become an issue also. Finally, fillers are not just expanders, they're bioactive. I firmly believe that they change the architecture of tissue. I found in surgery when people have had filler placed that they bleed a bit more, the tissue integrity is a little bit different, they just alter the tissue. So these are all the issues with having filler placed in your eyelid on a recurrent basis. So the point of this is just to say that there's nothing wrong with fillers. Just remember, when you start, most people kind of continue to have it done. Most people have it overdone. Most people eventually get swelling of the lower lid and color change of the lower lid. And most people have to have it removed so that a permanent solution can be done at some point in time in their lives. So keep all this in mind. And before you decide to start getting on this bandwagon, make sure you see an eyelid expert who does filler around the lids all the time, so you can have a good evaluation. This could be explained to you. Have a great day, all.